Hey everybody, welcome to another edition of Danny Brown Talks Phoenix. I am your host, Danny Brown. And as always, this podcast is brought to you by my real estate company, Myriad Real Estate Group, where we focus on helping both buyers and sellers in the greater Phoenix area. So recently we had the opportunity to sit down with Jerry Snow, who is a toxicologist at Banner University Medical Center. And we got into a deep discussion about opioids and how those substances are affecting, the United States and what people should do if they're addicted or dependent on those. And we wanted to do a part 2 to that episode where we discussed Arizona and kind of the everyday dangers that we face here in terms of the animals that we might come across while out hiking or even just being in our backyard, as well as common household items that you might have in your home and what to do if you or a child ingest them. So welcome back to the show, Jerry.
All right. Good to be here.
Thank you so much. So for those people that didn't catch us on our first episode, if you could give me a brief description and a little bit of background of who you are and what you do.
Yeah, so I'm, as you mentioned, I'm a medical toxicologist full-time at Banner University Medical Center here in Phoenix, having done a primary specialty in emergency medicine and then a subspecialty fellowship in medical toxicology. So it's actually what brought us out here to Arizona, is for me to have this opportunity to do medical toxicology full time. But I worked as an emergency physician for a number of years and still work a couple shifts here and there too, because I still really enjoy that work as well.
Yeah, I bet in the emergency medicine side of things, you see a lot of interesting things come through the door.
Yeah, it's very diverse. You never know what you're going to get.
So we'll jump right into it. So, living at home, you've got a lot of toxic chemicals probably right in your pantry, underneath your sink, that's easily grabbed by kids and people that don't know any better, people that should know better, ingesting things like Tide Pods recently, and those types of things. So what are some things that homeowners should be aware of as it relates to toxic substances in their home?
Yeah, I mean, so kids' exploratory ingestions is something that we commonly see in the big categories. Just when you broadly speak, is cosmetics are a big one.
Cosmetics like makeup and stuff.
Yeah, makeup and stuff, creams, oils, lotions. I mean, because especially a kid like under 2, ones that are mobile, but probably don't know any better, and they see like maybe mom putting on lipstick or mom applying these different things. The kids will just eat them or taste them. And I think the things that people don't think about, those are things that people don't think about, like those basic cosmetics and everything. But other household cleaners,
I just assume those things were non-toxic.
Well, the vast majority of them are, Danny, but there are hundreds, if not thousands, of calls to the poison center every year because some kid eats, lipstick or some type of other powder or lotion or cream. And not everything's benign. It depends on what the exact things make up that specific product. Household cleaners is another really big area. Things like, bleach or ammonia, things that are especially bad or anything that we consider like caustics. So like toilet bowl cleaner, drain cleaner, those are really terrible. And the vast majority of outcomes with those that we see, it's from small children get into those. So those are always things that you want to make sure are put away. You always need to be aware of when you have visitors or if you have medications, because kids love to do what mom, dad, or older brother, sister, or grandma and grandpa do. They see them take a pill. Kids are big pill takers. So if a pill's dropped on the floor and they find it, maybe they just think it's a Tic Tac or a piece of candy. Like or maybe they just think that they should take whatever grandma or grandpa's taking or mom or dad takes. So kids all the time, we admit kids all the time because they'll take a medication, and sometimes it's not a big deal. Like they took like one Benadryl or diphenhydramine tablet. Probably not going to be a big deal in a kid 2 or 3 years old. But if they get into grandma or grandpa's high blood pressure medicine, heart medicine, anything that just has to do with like the rhythm of the heart and things that are like for diabetes. I mean, they can cause. There's some pills out there. Like one pill can kill, even a small child. And then everything in the garage. So all the different fuels, anything that you have out there, like paint thinners, There's a lot of things that contain what we call toxic alcohols. Think products like, carburetor cleaner, just anything that you think of that you would use to clean something up with, like a solvent, or things that would be used to run any type of combustion device. Obviously, things like gasoline, kerosene, those are all bad to drink, obviously.
Yeah,
and,
obviously.
and even things that you don't think about being bad, for instance, like tea tree oil, which is just an oil, right? But if a kid aspirates that or gets that down in their lungs, they can become critically ill, because those things have such a low low viscosity. They're so thin that even if you drink it, there's a good chance it will go down into your lungs. And that can really cause some really serious problems. So those are all things that come readily to mind, when it comes to things. And then, of course, things like, herbicides, pesticides, pest killers. You wouldn't want anybody getting into anything like that as well.
What would you recommend to someone if their child or someone did ingest one of those types of products? What do they do?
Call Poison Center. So that's the easy, quick answer, Danny. A lot of the first aid stuff that was done, decades ago, like inducing vomiting, we don't recommend to do that anymore. The American Academy of Pediatrics, they used to have something called syrup of Epicac, which would make you throw up. It's taken off.
I remember that from an episode of Family Guy.
Yeah, right. No, we don't do that. So no more of that anymore. So we don't recommend that. But if you call the Poison Center, you might save yourself a trip to the emergency department. Because a lot of times, they did a study here some years back where they looked at, families calling the Poison Center, and then they just straight asked them, so if you hadn't been able to get this advice, what would you have done? And, the vast majority of the time, if you have a parent and they're worried about what their kid got into, they would say, oh, I would have went to the ER. And it was millions and millions of dollars saved, because you call the Poison Center and they say, okay, what were they exposed to? And they'll tell them exactly if they can tell them what the exact product is, they can tell them whether there's a concern or not. So they'll say, oh, this is perfectly fine. Hey, you know what? Watch them at home. We're going to call you back in a couple hours. Obviously, if they develop symptoms, call us back. So the Poison Center is a tremendous resource that's available in all 50 states. So every single state, even if it's not physically located in their state, they have a Poison Center that's available to them. And that's not only lay people, that's also medical providers as well. So that's 24/7, 365. That anybody ever has a question, and it can be for information only. You don't even have to have a specific concern at that moment. You could just, maybe you bring a product home and you go, I wonder what would happen, if my child did get into this. Is this something I would need to be worried about, even proactively? And they'll be happy to look that stuff up and give you the answer. It doesn't have to be, even an active case. But yeah, if you ever have an exposure like that, I would always just call the Poison Center. Even when I was a fellow, my oldest son had got an extra dose of medicine or something. Amanda was like really concerned. And I'm like, this is kind of what I'm training to do. He's going to be fine. And so I called the Poison Center. I actually called the Poison Center, even though I was the fellow at the time, and was like, hey, David, this is what's happened. Amanda's really concerned. Can you tell her like how long we need to watch Jack, whether we would need to bring him in? Do we need to do anything else at home? And of course not. Now I will caution you, there's a separate Poison Center for pets. So like you can't call about your dog or your cat and then, provide you information. There's a totally different Poison Center for animals. And, because the Poison Centers are partially funded mainly through the states that they're in. So, there's no cost for you to call the Poison Center. It's completely free.
That's good to know. Yeah.
Absolutely.
So I had heard that the poison control centers had an influx of phone calls when the president was recommending that people drink disinfectant and bleach to kill the coronavirus. Did you guys see anybody that actually did that?
I saw some reports. I don't know if I didn't take care of anybody personally. I know there were questions that come in about chloroquine, hydroxychloroquine.
Well, we had that couple that actually drank the aquarium cleaner, right?
Correct. Which was chloroquine. It was a very highly concentrated chloroquine product. And they thought, if we've got any ongoing COVID or anything, we'll take this and maybe this will help fight it. Unfortunately, as you know from that news story that was, national news really, that the woman actually got critically ill and her husband actually died. So there definitely was some instances, at least that one couple for sure, where, things in the news get people to probably try things that are totally ill-advised. And I had done a podcast for an EMS friend of mine who he's a medical director of an EMS service in Texas, where we specifically talked about the acute toxicity of hydroxychloroquine and chloroquine, which, hydroxychloroquine is used a lot medically to treat people with lupus and rheumatoid arthritis. It's used as an anti-inflammatory, and it is safe when prescribed by a physician, taken as such. And those are FDA approved medications for that specific thing. And then chloroquine is used for malaria prophylaxis. Again, the doses that are appropriate, they're relatively safe. But in overdose, they're both really nasty. And these are, again, like one tablet of chloroquine could kill a kid pretty easily, a small child.
And I had heard that people who actually need it were having trouble finding it because people who weren't supposed to be taking it were taking it.
Right. Well, I think there had been some kind of hoarding of it too. I think that when that initial news broke that there was potential, again, the key there is potential. It's still not been well studied, Danny. They're still doing ongoing studies. And what initially looked promising, like in the lab, when they've been giving it to patients, the last I had heard, it did not look super promising to impact the patient's outcome that were acutely sick in the hospital. Inhibiting viral, replication or impacting viral entry into a cell in a test tube in the lab doesn't always carry over to what we see clinically when a patient's like critically ill with a specific illness, and then we give them the medication. It may or may not have that same effect. But I think when that news initially broke, I think people were quick to kind of like, oh wait, in case I get sick, I'm going to get a prescription for this. That way I've got it. So I did hear about some even physicians like prescribing to friends or family members, or family or friends reaching out to physicians that they knew, saying, hey, can you give me a prescription for this just in case?
Wow. So that's wild. And what is your reaction when you hear someone like that say, what do you have to lose? Like, take this stuff. What do you have to lose? I feel like that's pretty irresponsible.
Yeah. I mean, I think that the evidence for something, it needs to be worked out better. So they had open trials. So like they were enrolling patients for these drugs to be studied. This is all stuff that should have been done or be done in a controlled environment, within the protocol of a study, to make sure that, there are less errors, the patients can be monitored carefully, and you can closely follow those outcomes. It's something that I can speak, only for myself, Danny, and say, like, had I been diagnosed, first of all, I wouldn't take it prophylactically at all. Like, I just wouldn't be taking it to be taking it. I don't think the evidence is there. I haven't seen any evidence to convince me that that's what I should be doing as a medical provider. And then if I became acutely ill, if they wanted to enroll me in a study, that's something that I would consider doing. But I haven't seen the evidence at this point where, like, if, say, for instance, Amanda got sick, that I would be like, oh, we got to get her on one of these, because there's clear benefit.
So let's talk about kind of some of the specifics to Arizona. We live in a desert climate. We've got a lot of critters that run around. You probably have them in your own backyard: scorpions, snakes, black widow spiders, wolf spiders, all those different things. So, what kind of dangers do you see most common in Arizona affecting us?
Sure. So I think, I was having this conversation with some medical students the other day, and they're like, well, tell us about venomous creatures and what do you see the most of, and what's most common in Arizona. So the first is probably not that exciting, but really, it still counts as a venom, and that's bee stings. Oh. Right. And not just, just in general. So all the Hymenoptera, but, we have Africanized bees too. So every once in a while, if you get a bee sting for every kilo of your body weight. So like, say, for instance, me or you, if we had 70 or 80, stings on us, we'd probably get pretty sick. We'd probably have some nausea and vomiting and diarrhea and abdominal cramping and feel pretty lousy and probably drop our blood pressure. And we will hospitalize a patient or two every year just from envenomation, massive bee envenomation. So that's a potential hazard that people need to be aware of too. And then, it shouldn't be taken lightly. A bee sting, unless you have like anaphylaxis or a serious allergic reaction, not really going to do you any, long-term harm. But you can even see severe rhabdomyolysis or muscle breakdown, even leading to kidney injury from a massive envenomation. So, like I said, those people end up hospitalized, lots of IV fluids, really watching their kidney function. So, even though that one's not like exotic and exciting, that's definitely one people just should be aware of. And then another big one that, there's thousands of cases every year, a lot of which don't even come to the hospital, and that's the bark scorpion. And the bark scorpion is spread widely throughout the valley. I actually sent Amanda a picture. There was one in front of our fridge dead last night or night before last. I actually took a picture of it. So there are many of those that present to the emergency departments locally throughout Arizona. One of our colleagues from the gym that we're at, Big Dan, he had a sting a couple years ago to the finger, and they actually called me and asked me about it, and I'm like, he's fine. What's he weigh, like 250? So like, he got like stung in his pinky finger, and I'm like, you're going to be fine, man. It's really the small children that we worry about with scorpion envenomation, and the very elderly or the people with a lot of serious illnesses. So small children can get like really significant nerve findings. It's really more of a neurotoxin. So you can't, it's hard to, you really can't even see where the scorpion stings somebody. And it's a sting, not a bite. People are always like, and a scorpion bit me. And I'm like, no, it didn't. It stung me. Stinger. So some of these kids get really symptomatic, and it almost looks like they're having a seizure. They'll have like such jerking and almost like convulsions, but they're awake, and usually they're very agitated. But it's their eyes that are really kind of the giveaway. Like if I get a call about a kid, one of the first things I want to know if this kid's just like agitated and really inconsolable, and the kid's like 6 months, 1 year, 2 years old. And the first thing I want to know is like what their eyes look like. And if you just have these roving eye movements, like going everywhere, and agitated kids,
they're like googly eyes.
It's crazy, Danny. You have to see it to believe it. I mean, it is impressive the amount of nystagmus and ophthalmologist that they can get. Their eyes are just jerking and snapping all over, and it's like random. It's not like it's like just keeps going to the right or something like somebody's having a seizure. I mean, they'll just be going every which way. But there is an anti-venom. So we stage the envenomation: stage 1, stage 2, stage 3, etc. And so if kids are a 3 or 4, they pretty much get administered anti-venom if the hospital has it. So like at Phoenix Children's and at Banner University Medical Center, we have anti-venom. So if kids are seriously envenomated, a lot of the time the emergency physicians have gotten so accustomed to treating these patients, they'll give them the anti-venom. And then when in a short amount of time, those kids are back to normal. And a lot of times those kids will even go home. Like there'll be an observation period of like 4 to 6 hours. And if that kid's like up, walking, talking, drinking, otherwise, and even if it's an infant, it's back acting normal for a normal child, that kid oftentimes will go home. And then for adults, if you just got like a sting to the finger, sting to the foot because you stepped on one or put your shoe in one. Actually, within a few months of us living here, Jack put his shoe on and got stung in his foot by a bark scorpion. And I watched him at home for a couple hours, and then I took him on to school and went on down to work, and he was fine. I mean, his foot was tender for a few days, but he never got a serious envenomation or effects from it. So yeah, so the bark scorpion definitely gets hundreds, if not thousands, of people throughout Arizona every year too.
Is the anti-venom something that you can just buy or order online?
No.
No? Oh, okay.
No, it's FDA approved, and I hate to tell you that, but it's thousands upon thousands of dollars. Yeah, it's very expensive. But I mean, obviously, if one of my kids got stung, and even though they're a little big to have that happen, if I had a small child that got stung and they were seriously ill, it could prevent them from having to go on the ventilator. So some of the kids, they'll have so much drooling and spasms around their airway muscles that they can actually lose their airway. So a lot of it, back in the day before the antivenom was readily available, some of these kids just had to be on the ventilator for a day or two. Now with the antivenom, you may be able to prevent that entire process.
Wow.
Yeah.
So what about, we do a lot of hiking, there's a lot of outdoor events, mountain biking, those types of things. What does somebody do? We recently, back in October, did a hike through the Grand Canyon. And I remember one of the things that you said repeatedly is if you get stung by or bit by a rattlesnake, don't suck the poison out. So, what, tell me a little bit about rattlesnakes. I'm super active. I've lived here my entire life, and I've only ever seen 2 out hiking. One was hiding, and I would never have even known it was there if somebody else didn't point it out. The other one was out in the middle of nowhere, and it was just Alyssa and I, and it was in the path, and then it left us alone. So
slithered away.
Yeah. So my personal, just anecdotally, I don't feel like rattlesnakes are that common, but I know that I'm wrong. I know that they're super common.
They're more common than you think. We'll take care of at least probably somewhere between 70 and 90 bites a year just at Banner University Medical Center alone. So we see several dozen every year for sure. And people need to resist the urge to want to touch the snake or handle the snake. They can't help themselves, especially dudes. So, but we have plenty of people that accidentally step on one. Like they'll go out at night to, get the mail or, shut something off because maybe they were irrigating their lawn, or they'll just kind of step out the back door for some reason and there's a snake and they just happen to step on it. So women tend to get bit in the lower extremity and men get bit in the lower extremity and or their arm, hand, face.
They're trying to pick it. It's so dumb.
People do all the time. And we get a lot of people that are like good Samaritans, or they think they're making a wise decision. They're like, oh, it's in the trail, like what you and Alyssa had expected. If you just wait for a few minutes and warn people as they come by, the snake will go. It'll slither off. It won't take but a few minutes. But people are like, oh, well, there's kids on the trail. I was trying to move the snake to get the snake off the trail away from the kids, or I didn't want anybody else to ride up on it or hike past it. And I just tend to kind of, because I've seen at least 3 snakes, I think, this year running. Of course, I've been out on the trails a ton. But I just usually stand there if I see anybody approaching from either direction and just tell them. And eventually, if you're kind of in the area, the snake gets wind of it, and they don't want to be around you either.
Yeah.
But the big thing that I'll stress to you is there's a lot of stuff that, years ago was recommended, a lot of first aid things that just really don't apply anymore. So no tourniquets. So you don't ever put a tourniquet on a rattlesnake envenomation. It may actually worsen the tissue damage at the bite site because of you don't want to trap the venom in like your finger or your hand or your foot or your ankle. You actually do want it to lymphatically spread. That way it's not concentrated, because that's going to increase tissue loss. So don't put a tourniquet on. Don't cut it. Don't suck. Don't put ice on it. These are all things you don't do. And sadly, I have to mention it because it's reported in the medical literature. Do not use electrical shock. It has no effect on the venom. And there have been multiple reports of people using electric shock because it's been proposed that it inactivates the venom. This is false as far as I've ever known. So don't shock. There's a great medical case report from here in Arizona where a guy had extreme anaphylaxis to the antivenom before. So he'd been bit like a dozen times. So him and his neighbor worked up this great plan where they were going to be like, all right, man, so if I get bit again, instead of going to the hospital, we're just going to use electric shock. So this guy ends up getting bit in the lip. So they hook up a car battery to his face. The guy gets in the car, starts it, revs it up. The dude loses consciousness, becomes incontinent, like poops his pants, still ends up having to go to the hospital, obviously, and ends up on the ventilator because he has such bad swelling and everything. But
he didn't die.
The extreme electric shock did not neutralize the venom, is what I'm letting you know. So don't try that one either. So a lot of it is, as I told people inquired about like these snake bite kits and stuff that you buy, and people when they hike the canyon and everything. The best thing you can do is seek medical care. You need to get to the hospital. If you're super lucky, about 20% of the time it's a dry bite, meaning the snake bit you. Its fangs physically entered your skin, but it didn't inject venom. Maybe it just was low on venom. And sometimes they just don't want to waste their venom on you because they can't eat you. So why would they? I just tell people you don't need a snake bite kit. If anything, you need like a way to communicate with the outside world. If you're in the bottom of the canyon, you just want to get to the next ranger station as quickly as possible. Or if you had some satellite communication device that you could use, but you just need to get to medical care.
So if you get bit and you're out in the middle of nowhere and you need to hoof it out, that increases your heart rate, right? So would that make the poison spread through your body faster? And is that bad?
Not necessarily. And there's never been a study, Danny, where they let people get bit by a snake and then they run them around to see or they sit them down and see who has a better outcome between the guy.
I feel like we just came up with a study that we could. I'm sure we could find some.
I don't think you're going to get past the ethics committee, though. It's all got to be approved beforehand. Yeah, I mean, if you were like out on the AZT or you're in the canyon, you're just going to have to do your best to get out or send somebody to get help to get you out. Because the truth of the matter is the antivenom is the only real effective treatment. And until you're able to be administered that, you're just going to have ongoing problems with the venom. Gotcha.
What about, spiders? I know we've got a lot of black widow spiders in Phoenix. And I think I recently read a story where 3 kids just intentionally had themselves be bit by a black widow spider because they thought it would give them superhero powers.
Oh, I have not heard that story. That's a terrible idea, Danny. It's a terrible idea.
Yeah.
Let me mention one more guy because I'm afraid we won't even mention him if I don't. That's the Gila monster. So the Gila monster is also venomous, but they spend like 80% or more of their life underground. So it's actually pretty rare to actually see one. Here's another one. If you don't mess with him or her, he won't mess with you. They would literally just like walk over your foot, even if you were like standing there barefoot, and they're not going to bite you. They're pretty docile. I've seen a couple of them since I've been here. And of course I got all up in their face taking pictures and stuff, but if you don't handle it, they're not going to bite you, but they're also venomous. It can cause a lot of pain and swelling. And
what I've heard enough are more like flat and they like grind it into you.
They don't let go. They like to like grab on and see, they don't have like an venom injection apparatus like a snake does. It's kind of they got like little grooves. So it has to kind of ooze down their teeth into you. So they just like hang on for dear life, apparently. But those are very rare envenenations. So just don't handle them. They'll be fine. So let's talk about black widows a little bit. So black widow envenomation is, they can be difficult to treat. It's also a neuromuscular venom. So what happens is they kind of wreak havoc and cause a lot of release of different things like serotonin, norepinephrine, epinephrine. So you get like hypertensive, tachycardic, tons of muscle spasms. The best case reports are ones where people's abdomens get so rigid they were actually taken to surgery because people thought they had acute appendicitis, but it was just a black widow envenomation. So we'll see a few of them every year. Most of the adults will able to treat with like opioids, like fentanyl, or other IV medications, including maybe like a benzodiazepine or a muscle relaxer, like diazepam or lorazepam, which you may be familiar with, like Ativan or Valium. Which people sometimes take for a variety of different reasons. And you can see those patients, benefit from that. Sometimes that's all they need. There is also an anti-venom for black widow spider bites as well. And if they are, again, there's a kind of a staging. So there's like localized symptoms, more regional symptoms, and there's like systemic symptoms with abnormal vital signs. So if a person's sick enough that they're like really tachycardic, hypertensive, like sweating, miserable, cramping all over, feeling terrible, that would be a patient you could have a conversation with. Keep in mind, all these antivenoms, they're like foreign proteins. So there's always a chance that you could have a reaction to one of them. So we always discuss that with a patient and let them know. I mean, of course, all these are being administered in the hospital in a controlled environment where the patient can be monitored very closely. We always administer our antivenoms either in the ED or in the intensive care unit. That way, if a patient would develop a reaction, we could, stop the infusion, slow it down, and or treat them for an allergic reaction or even anaphylaxis. So I always just have that conversation with the patients because, every once in a rare while, somebody will have a serious reaction to an antivenom. And they just need to be aware of that. That's the biggest precaution to take. But in my experience, the vast majority of black widow envenenations do not require antivenom. You can usually get somebody pretty comfortable. Thankfully, most of mine have been in adults too. So the smaller you are, the more likely, kind of like with the scorpions, you are to have probably more severe symptoms.
I've heard with the antivenom for black widows, you can only take it once. Is that true?
Again, that's concern for allergy. Again, I do believe, if I remember correctly, it's a whole, I don't think it's a fab. I think it's like the whole antibody. So there's just more protein there. So your risk of having a reaction to it are going to be higher if you're going to have a reaction. It's kind of like most allergies. You've got to be exposed to it once, typically, in some manner, when it's that re-exposure. So obviously, if you got it once and had a little bit of a reaction, I'd be concerned that patient would have a more serious reaction the next time. But you could probably get it more than once. But hopefully, you've learned to leave spiders alone.
Yeah, right.
After the first time around,
you're not gonna turn into Spider-Man, unfortunately.
Right? No, you will have no
as awesome as that would be. Yeah,
you will not be pleased with yourself.
With any of these bites, do you advise immediately going to the hospital or just hanging out and seeing what happens and then going to the hospital?
So for me, it depends on the envenomation. So anybody bitten by a rattlesnake, you just need to go to the hospital. I would advise the same thing for a Gila monster. I would say a scorpion, just like what me and Jack did. I would call the poison center. I would always just give the poison center a call and say, "Hey, I got stung." You could even send a picture to them. And they could help identify, a specific spider or even snake. They can help sometimes do that. We have herpetologists that we have relationships with, so we can send a picture to a person who specializes in reptiles and everything. But when it comes to snakes, I would just head on in, because you're going to need a while for observation, and you need blood work as well, because one of the other major effects that rattlesnake bites has is it affects your ability to clot. So it can affect your platelets and your clotting, and the only way to really tell if it's heading the wrong direction is to have that blood work, and then to repeat it later to see how all that's doing. So that's something you got to consider as well. Other envenenations, most of them, if patients developing symptoms at all, I would definitely just seek medical attention.
Gotcha. Are there any, our plants are pretty wicked out here with their thorns and needles and all that kind of thing. Are any of the plants out there, are they highly poisonous if you happen to get scratched?
So not as much through scratching, Danny. The biggest concern would be ingestion.
Okay.
More than everything else. In a big one that's all over the valley is oleander. So oleander, I know
that's really poisonous for dogs.
Right. So, well, it'll kill humans, just as easily. So it works like there's a pharmaceutical, there's a drug called digoxin, which is a heart medicine, and they use it in congestive heart failure as well as a rhythm called atrial fibrillation, because it can help kind of regulate the heart rhythm and increase the kind of the squeeze of the heart. So digoxin contains oleander contains a similar chemical to digoxin, and so it has similar effects. So I mean, if a person ingested digoxin or oleander, it would have very similar effects and could be life-threatening. Another plant is called red squeal. It's actually been used in the past as a rodenticide, so you could use it to kill rats. So like if rats ingest it will kill them, but the same can be said for us as well. And then some people might probably not hear as much, I think, in the hot desert valley, like growing out on its own, but people have as a plant. Some of the plants that people have in their house, like lily of the valley. Lily of the Valley, there was a great episode. I was so excited, nerding out when I was a fellow, because we were watching Breaking Bad. And in an episode of Breaking Bad, they're like, they make everyone think it's going to be ricin. Like did he poison him with ricin? Did he poison him with ricin? And it wasn't ricin. Then they pan over to a plant, and Amanda's like, "You're such a nerd," because like from way back before they even zoom in on the plant, I'm like, "It's Lily of the Valley," which is another what we call cardiac glycoside, which has a similar effect as the oleander does as well. And foxglove, I've actually seen foxglove here in the valley. All of these, foxglove, lily of the valley, oleander, and red squeal, all of which I've seen down here in the valley, all are cardiac glycosides and can be really toxic.
What about any of the plants that you see growing around, like our olive trees, the olives that come off of those, any of the berries, are those highly toxic as well?
There's nothing that I've run across here in the valley as far as like fruit bearing that I can think of that's highly toxic. I wouldn't say that a lot of things, if you eat them, they're going to disagree with you, and you maybe develop some nausea and vomiting for sure. But as far as But as far as like life-threatening toxicity from a small exposure, not as much as I'm aware of.
If you do ingest any of that stuff, is vomiting an option to get rid of that? I know we talked about before not to induce vomiting, but if you ingest a plant.
Yeah, so there's no studies on it. So when they've looked at the induction of vomiting or people throwing up, it's never been shown to benefit the patient. Of course, I'll take care of patients that take a bunch of pills and they throw up a bunch of pills and they get sick. It would seem to make sense that if a person vomited up half the pills they took, they would not get as ill. But I've still had people throw up quite a bit and still get really sick too. Because a lot of toxins will make you throw up. I mean, I don't know whether, it's when it hits your stomach and your body's like, we got to get rid of this. This is no good for us. But I've had plenty of people that are vomiting and they vomit till they're like unconscious because they become so symptomatic or sick.
It's a scary world out there.
You just never know.
We're very fragile beings.
That's why we have skin, Danny, to keep all the badness out.
Well, that's a good question. Can any of those, the toxic substances, the liquids, if you get that on your hands, if a kid crawls through paint thinner, can they get sick from, can that be harmful? It's
going to be very, very substance dependent, Danny. There are things for instance, some of those things you mentioned, like a paint thinner, it's a hydrocarbon. Some of those things are pretty volatile. So just inhaling it, especially in a closed area, because unfortunately, as you're probably well aware, like junior high age kids, that's a substance of use for them. So, I mean,
Sure.
kids will huff, like huffing or what we call inhalant use. So even a small child that was exposed, I don't know if you've ever been like I know the other day I used some shoe goo to repair a sandal of mine. It has toluene in it. And I was in a smaller room in our house and just, I mean, a dab, like a Q-tip sized dab on that sandal. And I was like, whoa, like I got to get out of here, turn the fan on. It was like almost like not overwhelming, but like I clearly was getting a good exposure to that stuff. And long-term exposure to that stuff can be really bad. But there are some things that will absorb through your skin, and pesticides are a good example of that. There are plenty of things that just through skin contact, you get enough of it to be systemically ill. Absolutely, especially with chronic exposure.
So then your statement about that's why we have skin doesn't really
always hold true, but you're still better having skin than not, Danny.
All right. Well, is there anything that we didn't cover between the last podcast and this one that you wanted to touch on?
No, I think it's a pretty good overview. I think you get a sense for what it is that me and my colleagues do. I really encourage people to utilize, the Poison Center. I think it's a really great thing that people don't always think about or realize it's an option out there for them. And I mean, and it's the Banner Poison Drug and Information Center. So it's just not about toxins. It's not about just poisonings and envenenations. People could call it because they have a medication. If they have a question about their medication, even. So if they just are like, hey, I've just started this new medicine, I'm on this other medication. Hey, are they going to interact? Maybe they forgot to ask the pharmacist before they left with their new prescription or something. Or, I've got concerns about this medication. I'm having these symptoms and I started this medication a week ago. Could that be from this medication? The Poison Center is happy to answer those type of questions or concerns. And so I would just like to see people, utilize that there, because I think a lot of people are trying to, be Dr. Google and look stuff up themselves on the internet, which, the internet's great. I mean, I use it all the time for all kinds of stuff. But I think there are people that are specifically trained to get access to certain specific information when it comes to drugs and toxins. And they're in the Poison Center, and it's what we do all the time. So people should utilize that service.
I would say the Poison Control Center needs to have a better PR and marketing department. Never even occurred to me to reach out to them. If I had a kid and they got bit by a scorpion or ingested something, immediately in the car to the hospital.
Amanda, so
would register.
There's a national number, Danny, 1-800-222-1222. And Amanda's like, I don't like that number. Amanda has always been like, that's not helpful, Jerry. And because there's your local number, but no matter where you're at, there's a national number that you can call. Will always get you in touch with the Poison Center.
Awesome. Well, we'll make sure to put that in the show notes as well. So thank you again, Jerry, so much for spending 2 podcasts with us. You were a fantastic guest, and I learned a lot about opioids and dependence and addiction, as well as animals and plants and toxic chemicals in our house that we should avoid. So appreciate the time.
Absolutely.
All right. Well, thank you guys so much for tuning in. This was another episode of Danny Brown Talks Phoenix, and we will see you next time. Thanks so much.